Flower Pot NYC is America's leading brand design and packaging agency for cannabis and emerging brands. They're cannabis consumers themselves, so they design packaging that doesn't just look beautiful, it protects and showcases the integrity of the product inside. Over the next 3 months, they're offering $1,000 off your first order, plus $1,000 if you refer a brand that becomes a client. They'll even beat your current packaging invoice by 5%. Or walk away. There's some conditions that apply. I'll let them handle that. Family run, good people, great product. Flower Pot NYC. Grow with us.
Magazine. Welcome to Greenway Audio Magazine. My name is Tim, and with me is Brandon Dunn, as always. And today we have the CEO of Vlasic Labs, Willy Vlasic, everybody.
Thanks for having me, boys. Appreciate it.
Thank you for joining us. Let me just tell you right off the bat that anything Vlasic is a staple in my proper order. The dog treats are my dog's favorite. I have the CBN, CBG, CBD, yes, those tinctures, and the roll-on. So they have been a staple in our house for years. There it is. That's the one. Smells delish. So yeah, very familiar with you, the brand. So I'm glad you're on here because we want to get into the history of Vlasic in Missouri, which started 2020, right?
Yep. Yeah, it's been a while now.
Holy and let cow. Me just say that I'm disappointed that there is not a pickle flavored fruit chew or something at this point. So.
I know, everybody. I get that question about once a week.
I bet.
Oh, that's not a question, my friend. That is a statement.
We sold the pickle company about 50 years ago now, and they've kept the family name on the brand all these years because
cool. the
brand was so strong. Although we went from flipping pickle bags to nickel bags, as we like to say, we've moved on to creating the next great Vlasic consumer brand.
I will say, you and I first met like 5 or 6 years ago. It was pretty brief and stuff like that. They introduced me to you. I think it was Andrew Mullins that introduced me to you the first time, and it was at a MoCan. And they were like, "Oh, Vlasic," and I was like, "Oh, that's cool." Like ironic, like sounds like the pickle people. And that was all I thought about it. And then like 6 months later, somebody's like, "Oh no, that's the same family." I was like, "Oh, okay."
So it's not just you. It's not just you. I had a lot of friends in Missouri and in the Michigan market that didn't know about our family for years. Really until we created the Vlasic Labs brand. I never really wanted anyone to know my last name. I was always Willy V, even, back in the caregiver days. I didn't want anyone to make any assumptions about me or how I got in the industry or anything. And so it was a little weird at first, saying, Vlasic like the pickle and walking into every dispensary. Hey, I'm Willy Vlasic, CEO of Vlasic Labs. So it's now I'm used to it and I love doing it. But it was definitely a big arc for my cannabis journey.
I think you're pretty familiar with him and stuff, but Adolphus Bush has said some similar things before, like not that he's not proud of his family name, but he wanted to do things on his own without using the family name before he, really allowed everybody to be like, oh yeah, tie these two together now. But he wanted to like get his chops first type of thing. So
got a funny story about when I met Adolphus. We were in the parking lot of our cultivation facility in St. Louis back in the day, and I was looking to sell him some fresh frozen for Teal. And, we're finishing up our meeting, and I shake his hand in the parking lot, and I'm like, it'd be great to do business, one great food and beverage family with another. And he kind of just looks at me like, huh? And I'm like, Vlasic, Bush, you guys are a little bigger, but, and he's like, okay, whatever, man. Like, and now we're best buds. We were snowboarding in Japan a couple months ago together.
That's amazing.
Yeah, you're a big snowboarding guy too, right?
Oh yeah.
There's this like secret clique in Missouri. It may not be that big of a secret, but
some of the guys that we just had our 5th year trip. Yeah,
Okay,
so I
we've heard about
helped
this.
organize those trips, and we went to Japan for our 5th year. Went over to Hokkaido, and we were eating Wagyu ramen on the mountain and going to karaoke at night. So it was a lot of fun.
Amazing.
I still eat regular like 10-cent ramen, so I'm clearly
that's
not
all right.
part of
Well,
the
in
Japan
Japan,
snowboarding
everything's so
trip.
cheap on the mountain. I mean, the skiing, the food is like $10 for Wagyu ramen on the ski mountain. You go to Colorado, and it's 30 for bowl of chili.
That's crazy. I could talk all day about Wagyu ramen and snowboarding, but I think we're supposed to be talking about something else.
Yeah.
The first thing I'd like to start off with, we've kind of established the family history and stuff, but you've been in the Missouri market for a while. One of the things that you did in the Missouri market that you're doing in a few other spots around the nation, we just had this year's Missouri Vlasic Classic golf tournament. You guys raised over $25,000 just in Missouri this time around.
Yep.
You also do this in Michigan and in Las Vegas as well, right?
That's correct. Yeah, we just had our 4th annual Missouri Classic. We've got our 3rd annual in Michigan coming up at the same course where Live Golf does their championship. And then our 2nd annual in Vegas. And now after the Missouri one, we've raised over $165,000 over the past few years, over 7 or 8 classics.
Wow.
And I'm hoping to get that to 200 by the end of the year and bring Jared Shaw home.
Yeah. Unreal. Let's get into that story. It blows my mind. So Jared Shaw, he was a basketball player. I think he played Utah State, I think, in college. And then, so he went over, he plays overseas. And that where overseas? Was it Indonesia?
So he was in Indonesia. And Jared, he's played all over. He's played in Japan, actually, in a few different countries around the world. Really talented gentleman. And he has Crohn's disease and, serious health issues because of it. And so, he's always self-medicated. He ordered some gummies online from Thailand to his house. And it was only like $400 of gummies, and 3 police officers, Indonesian police officers, showed up at his house, and he was sentenced to death row over $400 of gummies. Wow. When this all happened, my good friend Dante West, who was with Last Prisoner Project for a long time, and now he has his own foundation called The Forgotten Prisoner, he heard about Jared's story, went over there, became his international advocate, raised a couple $100,000, including big donations from Puffco, and we donated, and a lot of the classic sponsors last fall. And thanks to Dante, I mean, he is like a prophet or something. I mean, he's just such a good person that what he's doing and the reason he's doing it to help these people is incredible. But thanks to Dante and all these sponsors and donors, we were able to get his sentence reduced to 26 months. Which is obviously a huge win. And at the time when he got death row, there was a huge media frenzy, all these big media outlets telling his story. And then he got off death row and people kind of forgot about him. And that's why Dante calls his charity The Forgotten Prisoner, because although it's a huge win, obviously, to get him from death row to 2 years and change, he has Crohn's disease. He has now E. coli and internal bleeding from being in this prison. He's lost 50 pounds. He can't play pro ball anymore or support his family, and he's dying in prison. And so the Forgotten Prisoner is all about, raising awareness, PR, and raising money to help these folks that have been forgotten. And Jared right now is our primary and only focus. And we're confident we're going to be able to get him home early.
Wow.
But it's a very different system over there in Indonesia. And 400. The only reason he was able to get off death row is because he was able to prove he had a life-threatening, serious medical condition. And it was the first time an Indonesian prisoner was actually allowed to leave the prison to have a specialty doctor visit, which was who, proved he had Crohn's disease. And that was how they were able to get his case reduced, although 20 packs of gummies isn't exactly enough to say intent to distribute. Over there, CBD is the same as fentanyl. Same as cannabis. All drugs are extremely illegal. And, he made a mistake, and he's such a nice nice young man. We've talked a handful of times. He actually called in on an audio call from his prison cell to the Vlasic Classic and spoke on TV to all of our guests, and there wasn't a dry eye in the room. So, all this media and awareness, as much as the money helps, getting him home, getting him a doctor, getting him back on his feet, helping his family, that's crucial. But the awareness and the media and the fact, we have this golf tournament and his brothers came, the hope you give these people is almost just as important as the money, because until you're able to get them home, that's all they have. But yeah, it's very important to us and our family, to get Jared home and just keep helping these folks while we get to be in this industry and smoke joints on the golf course and go to fun MoCan after parties and do these different fun things. There's people locked up, and I think everyone in the industry should be obligated to support these causes.
Absolutely. It's really interesting because I know my brother has Crohn's disease, so I know like how insane it is and how intense it is for the person and for the loved ones around them. And it's great to hear, hey, we got the sentence reduced and everything. He's still sick. He's still
in a third world prison.
Exactly. So like it's a great victory and everything, but he's still the problem is what he was trying to address was the pain from Crohn's disease, which is just it's insane. But so I like that, that's what we're moving towards. We're getting the awareness and everything. But I also think it's interesting that you guys and just from working in cannabis, I can't make medical claims, but I know because of my brother, the efficacy of CBG for people with gut issues. And I know you guys have a tincture, which I get regularly to help with stomach inflammation and that kind of stuff. So I think it's really interesting. You guys also have something that could help. Unfortunately, he can't use it.
I wish I could get it to him. And, the second he gets home, we'll be hooking him up with a lifetime supply of CBG for sure.
So when is his like release date? It's gotta be close.
He still
right?
has another 18 months or so. But we're going to get him out early. I'm confident, I would like to get him out before the Vegas Classic in October, but this year, like that's, I was actually asked by a friend, by Boston. He was like, if you could do one thing this year, what is it? If you can accomplish one thing. And for me, it was to get Jared Shaw home.
Mm-hmm.
And I got to meet his brothers who are awesome. And, it affects the whole family. I mean, your brother has Crohn's, but now imagine he's in prison on the other side of the world, and he's like the provider for the family. He's been helping his mom with, the money he makes playing basketball, and he's 35 and he's lost 40, 50 pounds. It's going to be hard for him to ever play basketball again.
Sure. Yep. Wow. Holy cow.
It's interesting because since we've started this, obviously we've been in the industry for a while and stuff like that, but we've been doing this podcast for about a little over a year now. And one of the things that we see over and over is there's all these lines that kind of intersect over and over again in the cannabis industry or in the cannabis world and stuff like that. There's people that come from the hospitality industry, people that come from the music industry, people that come from, arts and stuff like that. Then there's all these people that are really into the health side and stuff. But time and time again, a lot of the people that find their way either into the industry or even just advocacy are athletes. And whether it's someone that has a serious condition like Jared who has Crohn's, or whether it's someone like Kyle Turley or Grant Wistrom or Mike Jones that have found their way to it because of therapies and stuff. Jim McMahon has been preaching about it since he retired. But it's the athletes that keep crossing this, and then what happens is we see these athletes that either they're they're moving back from being a professional in the US, or maybe they didn't make it to the league or something, so they go and travel internationally. We saw it with Brittany Griner a few years ago and stuff. Time and time again, we have these athletes that are traveling internationally, and they aren't aware of the different laws and different differences between cannabis and marijuana and things like that from one country to another. Or they wind up in Europe, and there's 6-7 countries all closely knit together, and they're in Spain one day, and then they're in Italy or Russia or something a few days later, and there's completely different laws, and they don't know that. Spain is very, very strict. A lot of the Nordic countries like Holland and stuff are very not strict on cannabis and stuff, and especially like hemp and hemp products. And so I think one of the big things, we talk a lot about education and what cannabis can do. I think one of the big discussions that we should start having, especially with kids whenever they're in high school and college, is what the differences are from country to country, and that just because it's okay in your state doesn't mean it's okay whenever you travel for school or work or whatever it happens to be, because I think a lot of times people haven't had that exposure. We're in a country
or
where
they don't realize how bad it really is. They're like, oh, well, it was illegal in America, and I smoked weed when it was illegal here, but it's not the same thing as when you go to the Far East and some of these more strict countries. There was a gentleman who had a car accident in Dubai, and they had done blood work because he was in the hospital, and they saw that he had cannabis in his system, and he said, yeah, I smoked 3 weeks ago in California, and he got put in prison for 6 months in Dubai. And they probably wanted it to be longer, but he managed to get out and everything. And it's just insane. Like, some of these countries, if you have it in your system and you get injured or go to the hospital, you can even get yourself in trouble. So it's and it's different in every country, so you really need to be careful when you're traveling.
So Tim's gonna start the new international travel education agency. Before you leave, before you get on a plane, contact Tim. We'll put his cell phone number down here at the bottom or something. Just ask him what the laws are in the place that you're going to, and he will look it up for you on Google.
Did you see that the U.S. the TSA changed some cannabis?
They did. Yeah, in my local airport, the Detroit airport, they've allowed you to fly with up to 2.5 ounces for quite a while now. I try and go between rec states as much as possible, or at least medical states. I avoid the states without legal cannabis because I was smoking before it was legal, and I don't want to go back.
Right. Yeah. That's interesting. I love the change. It wasn't broadcast like I wanted it to be, but it was out there. It came out a couple days ago. I was like, yeah,
I saw it.
It's been very unspoken, but now it's spoken. So I kind of I like it.
Yeah.
So I'm not going to tell people exactly. You read it yourself. I'm not giving any advice. We had Eric Walter last week, and so I'm no longer saying anything legal because I don't want to put anything incorrect out there.
Google AI is a hell of a tool. Just pop it in, and you'll know what the rules are, where you're going.
I'm curious, Willie, like what percentage of your company is focused on pets? Is focused on like animals as far as the CBD goes? Is that a big portion?
Yeah, it's our biggest seller on the hemp side. So the dog treats do very, very well. They're in over 100,000 homes. Got them right here. This is actually my dog Yogi. He's our director of canine affairs. And then Ozzy, our 15-year-old golden retriever, he's our chief morale officer. And the vet just told us he's the healthiest 15-year-old golden they've ever seen. I mean, this guy is spry for a 15-year-old golden. But yeah, the dog treats are our number one seller on the hemp side. And, as far as our split between hemp and cannabis goes, I'm 90% focused on the hemp side. I had a grow in Michigan. I sold it. And then I was a part of a vertical in Missouri that we exited last year. And I have a grow in Vegas as well. It's a separate business from Vlasic, but, I help raise the money and I'm on the board. And we license our brand into, that facility, which I'm a part of. So we're selling Vlasic flower in Vegas, and it says Viva Las Vlasic in the Vegas sign right on top if you're ever out there. But I would say 90% of our business is, and time is focused on the hemp and the CBD. We're selling in 46 states and about 900 licensed dispensaries across the country. And the dog treats are the best sellers by far. We actually just doubled the potency of our bacon chew, and we're keeping the price the same. So all of that potency is going to the customer, and we'll be doubling the salmon and the beef chews as well over the next 1 to 2 months. So all the treats now will be 10 milligrams per treat, still 30 in the bag, so 300 milligrams instead of 150 in the bag. And if your dog likes 5 milligrams or has been eating a full treat, you can break them in half real easy.
Yeah. They're great. I mean, they have helped. We've had a lot of aging dogs over the years, and hip dysplasia, just bad legs, as you grow older, and the power that CBD has sometimes over the medications that you're giving these dogs.
It's really miraculous. Not to make any medical claims, but
agreed.
I mean, my dog Ozzy, we were giving him like 2 treats a day, one in the morning, one at night, 10 milligrams. And I noticed his back legs weren't working as well and was kind of struggling to get up. We started putting our CBD broad spec tincture on his food, and we increased his dose up to 25. And if he's having a really bad day, we'll even go as high as 40 or 50. And he immediately started getting up with no issues, going on longer walks. And we've been giving him CBD for 9 years, and golden retrievers don't live to 15. And he is a beautiful, healthy dog. I mean, you'd think he's probably 8.
Wow. Love
so
it.
It definitely works. We had another story, and this is someone else's testimonial, not my own. But we had a friend whose dog was having some really, really horrible issues and couldn't move and was going to the bathroom inside, crying in pain. They took it to the vet. The vet said it's time to put the dog down. So they scheduled an appointment for that Wednesday to put the dog down. This is on a Monday morning. And they tried CBD, probably had a product that, wasn't great since there's so much fraudulent hemp products out there. And, it was on glucosamine and prescriptions, and they tried it all. And my dad heard about it and was like, can we just bring you some of our CBD treats to like maybe give your dog some relief in these final couple days? And they're like, sure, we'll give them anything. We're putting them down on Wednesday. We take some treats over there. They give their dog 2 treats, like Monday afternoon. Tuesday morning, it starts to hobble around and move a little bit. And they're like, like maybe that helped him a little. So they gave him 4 treats. And the next morning, Wednesday morning, when they were going to put the dog down, the dog was running around in the snow. And they canceled the appointment, and the dog lived for another 18 months. And I met the dog a year later, and I had a limp, but it was smiling and walking and moving and could go to the bathroom outside. And, so it's incredible what can happen. And, maybe it was just what that dog needed, but, I know that family, they love Vlasic. That's for sure.
Now with 6 locations across the St. Louis area, Kind Goods makes it easier than ever to shop locally for quality cannabis. This locally owned deli-style dispensary offers premium flower, personalized service, and one of the largest deli-style selections in Missouri. Visit Kind Goods in Fenton, Manchester, St. Peter's, Soulard, On the Hill, or in Maryland Heights. Same standards, same care, now with more locations near you. Learn more or find your closest store at thekindgoods.com.
We had a Doberman Mastiff mix, and he passed away a couple years ago, but he had epilepsy. And, whenever you've got a 150-pound dog that is epileptic, it can be problematic, especially with small children and stuff. He was on phenobarbital. He was on all the same epilepsy medications that they give to kids and adults and stuff. We started giving him CBD, and the number of seizures went from as many as 4 or 5 in a day sometimes to 1 a week or less. And then eventually, over a couple year span, it did ramp back up and stuff. Like there just wasn't enough CBD that we could give him to keep it from coming back. But we went down so significantly. We went from, sometimes 5 in a day, but definitely multiples per week, to less than 1 a week for multiple years. And then it started to ramp back up. So I will always say that, anecdotally, I think CBD is one of the best things for animals and for people. And that kind of brings me to one of our talking points that we talked about before the show started was you guys have a hemp business that not only is not being impacted negatively by recent federal and state changes and stuff, you guys are going to benefit exponentially from rescheduling because you've positioned yourselves as a healthcare brand, as a medical product, rather than an intoxicating hemp product. And so you guys are going to be forever beneficial, and it's going to have zero impact on your operations at all, as far as any kind of scale back. It probably scaling up, correct?
Yeah, the federal news has been amazing for us to hear. It kind of validated all of our strategies over the last 4 or 5 years. We sat on the sidelines while we watched everyone do their D9 HHC nonsense. And, I come from state licensed cannabis, so most of my relationships are with licensed dispensaries. And even if I'm sure I could have gone and sold D9 to smoke shops and made a few $1,000,000, but not only would that reflect poorly on us to our primary dispensary customers, but it also would reflect horribly on the Vlasic name. At the end of the day, we're not in this for quick money. We're in it for the long term. I won my first licenses 8 years ago in Michigan, and I was a caregiver before that. And, I'm going to do this for the rest of my life. And with the federal news, it really made us really happy and validated everything just about, taking the high road and operating as the Farm Bill intended, not as it was written. It was written incorrectly. That is not what they intended. And, for me, it'll always be state licensed cannabis and then non-psychoactive hemp. And with the new rescheduling, the CMS news to be able to have senior citizens, anyone over 65, reimbursed through Medicare for $500 of CBD a year is huge. And it's all great for cannabis too, because it destigmatizes it and it's, good for the public perception. But as far as immediate opportunity goes, I feel like we couldn't be in a better spot. Based on the rules the CMS released, we qualify with all of our products except for the dog treats, because they're not senior citizens. Although maybe there's a loophole for if we go in dog years. I don't know.
We just got to get them in dog years.
Yeah, but we're actually already pitching some big hospital groups in Michigan that we're connected with, and it's going to be pretty interesting going from walking into dispos, wearing my tie-dye, selling, to suiting up and going into a hospital and doing corporate pitches. So that'll be fun learning experience. And, I've done a little bit of that. I don't mind throwing a suit on. I definitely would rather be in my my joggers and my Grateful Dead hoodie, but it's going to be fun and the opportunity is huge. And if we can get into one of the bigger hospitals we're looking at, that could completely change our business model. We're not going to stop selling to the dispensaries. We just may have to divert some of our focus towards these hospitals. And if we're able to accomplish that, it'll help the dispensaries too. It'll help our online sales. It'll just further legitimize us as a brand. Like, look, this brand's being recommended by doctors. You can trust it. I feel like it's a higher level of compliance. And, we really pride ourselves on being like ultra compliant, having the most certifications on our packaging. We're CGMP, we're made in an FDA compliant facility, and going above and beyond what is required for dispensary sales, which, most hemp companies aren't even at the bar to really be able to sell in dispensaries. And have accurate COAs, and be within a threshold that's compliant for each state, which every state's different. But on the pet side, we've also been going after the NASC certification, which is the National Animal Supplement Council. The FDA refers to them on all animal feed, and that's required to sell into PetSmart, Petco, Big Pet. And so, on the human side, we're getting our T's crossed and our I's dotted to be able to sell to hospitals through insurance. And with the pet stuff, we're going after Big Pet. And I think that's just going to help our dispensary business even more, just legitimizing the level of legitimacy that we have.
One of the things that I find most interesting, both about you and the company, and that I think a lot of people may not be looking at yet, you guys are basically the flagship for the cannabis industry as we move, as medical marijuana, gets rescheduled and stuff like that. But you guys are going to be the first access point for most physicians, most doctors, most hospitals, anything like that is going to be a trusted CBD brand that, years ahead of when anything can be done federally with your insurance for your medical marijuana. That's going to start taking place now with Vlasic products and with the relationships that you guys build with hospitals and with physicians and with name recognition. And so you're going to be the first entry point for a lot of physicians, a lot of nurses, a lot of LPNs, a lot of hospital and healthcare administrators, insurance companies, and things like that. You guys are going to be the flagship. And not to sit here and pat you on the back and butter your bread or anything, but
you can butter my bread any day.
I'm really excited that it's you guys, because I do appreciate that you guys have always stayed the course with what you're doing, and you've been both an advocate for medical marijuana and legal marijuana and cannabis, but you've always looked at it through a healthcare lens and how your products supplement the healthcare side. And long term, that's where everything federally legal is going to be related to healthcare, I think is the writing on the wall. The rescheduling of only medical marijuana in medical marijuana states and state licensed facilities is really the signal point for that. And so I just wanted to say congratulations, and also, like, how do you guys approach being the first through the door, essentially?
Yeah, I mean, there's a handful of other companies that have done things the right way that are going to be getting into. You have like the Charlotte's Webs of the world and a couple others, but then you also have a ton of hemp companies that broke all the rules the last 5 years, selling psychoactive products that are now scaling that down and trying to transition into this. And they will be exposed. And I don't think any hospital should work with a company that's been selling 200 milligram D9 gummies in smoke shops that middle schoolers can get their hands on. So I do feel like we are perfectly positioned, and there aren't many companies that are, and the name is going to help a ton too, because you think with Vlasic, all of our marketing says from the family that brought you America's favorite pickle, but the largest consumer or the most loyal consumer of Vlasic pickles is the senior citizens. They've been eating Vlasic pickles for decades. And so from a trust standpoint, the name has always helped, having the certifications and the COAs on our QR codes and, nice, healthcare looking packaging. It all helps, but the Vlasic name has helped a ton with the dispensaries. People are looking for a product. They don't know what to trust. They know there's a lot of bullshit out there on the CBD side, and they see a name they know and trust, and they try it, and then they fall in love with the quality. And we take that extremely seriously. I mean, we didn't need to get into the cannabis space. I dragged my family into it, and my dad and I were 50-50 partners in a few deals before we started Vlasic Labs together. And, on the healthcare angle, I feel like that applies everywhere. And even for the dispensaries, we want our CBD products to look like something you could go and get at a CVS, because at the end of the day, like recreational adult use cannabis products, they should be fun. They should be trippy. as trippy as, well, the state of Missouri will allow. But like in Vegas, for example, our flower jars are crazy. And then you look at our CBD and it's like, you know, I've seen brands out there where it's a CBD dog treat and it's like a reggae dog smoking a joint. That's not what you want to give your pet. You want to give them something that makes you feel like this is like healthy and good for them. And thankfully with CBD, you're not supposed to give your animals THC. And so it's helped bring a lot of people back around to CBD in the Missouri dispensaries and nationwide. You know, they see it and they're like, oh, there's something for my dog. Like I can give that to him while I smoke my joint. And like you were saying, when you give a dog 5 or 10 milligrams, you notice incredible effects right away. Where for a human, we need 200 to 300 milligrams every day for at least a week to get a true efficacious result from CBD. It's like an antibiotic. And a lot of people they either tried a bad CBD product or they took a 10 milligram gummy, didn't feel anything and thought, oh, CBD snake oil. But now they're seeing a cute dog on a nice package from a name they know in every dispensary in Missouri, and they're bringing it home and giving it to their dog and seeing their dog benefit. And then they're coming back and trying our high potency tinctures or bath bombs or whatever.
Will, you nailed two things that I was going to bring up. Your positioning in a dispensary is unbelievable because it's outside of the room. You know, so when you're in the waiting room, it can be out there. So it's sitting there. So when you're sitting in the waiting room, you're actually going, oh, what is that? Pick it up. Okay. Oh, what is it? So you get first line of sight from the consumers before they even enter into talking to the bud tender. The second thing you pointed out was, and this has happened to me a couple times, I have ordered Vlasic and gone up there and they said, we're out. Here is, I won't say the name, but there is another brand that has a dog smoking a joint or whatever. And I said, no, I don't want it. So when you're sitting there looking at this rack, and I'm sure they're a great brand and great people and all that, but when you're sitting there looking at the shelf and it has Vlasic and it has reggae dog smoking a joint, anyone that owns a pet is going to go, oh, well, I want the one that actually looks legit,
healthy
and
healthy and legit. Yeah, yes. For sure. And there's a lot of brands out there that have, you know, similar branding to like that trippy, fun cannabis style branding, which is great and cool for cannabis. But, you know, for CBD, it needs to be completely different. And
yes,
you know, if you saw our packaging in Vegas, I mean, we have one that's like a blackjack dealer with a muffin head dealing cards. And we have one with a Lambo driving by the Sphere with an orange in it. And we have one that's like Fear and Loathing, all fractal, super trippy packaging. It looks nothing like our CBD packaging. And we want people to know, okay, if you're in Vegas, you go to Vegas, you can buy our fun, trippy adult use cannabis in our cool jars. And if you want our CBD, like they're very different lines.
Yeah.
And we want to make that distinction.
Yep.
Here's the thing that I always tell to my kids and stuff, because I've got a 16-year-old and he's going out into the world and, you know, trying to do things. He's currently soliciting donations and stuff for FBLA. He's got a big trip coming up and it's going to cost a lot of money, sponsorships and stuff. You want to put your name on the back of a high schooler's t-shirt, I can hook you up. But I always tell him, you have to know your audience and you have to know who you're pitching to. As you said earlier, you walk into a dispensary and if you've got a Grateful Dead hoodie and joggers, that's one thing. But would I trust a doctor or a veterinarian that looked like the packaging for that dog treat? If I walked in to the vet's office or to the doctor's office and it reeked of weed and incense and it looked like Coast to Coast Records back in like 2001 and you had to walk through a beaded curtain to get into the exam room and stuff, would I stick around? Probably not. Maybe, but probably not. I definitely don't think my insurance is going to pay for it. But you walk into a regular, you know, clean hospital or doctor's office or something, and that's kind of the problem that we've always had with cannabis is it's hard to tell everybody that it's a legit medical product and that it has all these medical benefits if the only perception of it people ever see are the kids from that 70s show and Cheech and Chong and on and on. And so we've said many, many times, destigmatization is pretty well past where it is. Now we're looking for normalization. And the best way to normalize is to present both sides as they actually are. Adult use is supposed to be fun. It's supposed to be Bud Light and Heineken and Captain Morgan and all
and
that
Voodoo
stuff.
Ranger, trippy and fun and cool. You have the Bud Lights and you have the fun ones,
But it's supposed to be something fun. It is not supposed to be something your doctor is recommending for you. It's
the problem is so many of these markets are dual use medical rec, like Vegas. It's all pretty much the same, and there's products being sold as adult use products in Missouri, so they can go to all the stores and get the benefit of the business that are medical, ratioed products, THC, CBD 1-to-1 products, like the Heartland Labs stuff. Like there's a lot of great medical cannabis products on the market that are being sold as adult use. And so, it's almost like they need to categorize it and be like, okay, if you're selling a topical, you need to be under these regulations. But if you're selling a flower or rosin or a hash hole or infused pre-roll or cart, you can have more fun with it, and that's how I feel like it should go, because there are products being sold in the adult use market that are packaged very medically, very consumer, mass consumer friendly. And it just blows my mind that the government now is trying to separate it into 3 buckets. I was calling it the bifurcation of hemp and marijuana, and now it's really trifurcating the trifurcation of the industry. Now they want to define it as hemp, medical marijuana, and recreational marijuana, which makes no sense, because all these markets, for the most part, once it goes rec, it's pretty much all rec, and there's still some medical holders, but 98% of the customers are adult use.
I think as federal regulations get sorted out and FDA comes into play and stuff like that, I think we'll see more separation of this is a medical product. This is something that your insurance company is going to approve. I don't think we're ever going to get to a point where insurance companies are approving smokable flower.
No.
Or
nothing smokable. And that's actually part of the reason, not the insurance, but we don't sell any smokable hemp products. It's not the healthiest way to ingest. I smoke a lot of cannabis and I do a lot of rosin dabs. I love smoking cannabis. But at the end of the day, if you want a truly medical, if you're buying a CBD product, you're buying it for the medical use. And the idea of vaping or smoking your medicine, from a medical doctor standpoint, is not the best way to consume it. Although I medicate with, I pretty much only smoke and dab. I don't really like edibles that much. They make me useless for 4 hours, So I'm a big recreational user, and it's fun spearheading this very medical CBD company that's targeting dispensaries, because when they meet me, they it's not like what you'd expect. You hear Vlasic CBD, you expect we're some huge corporation, and we're a small family startup. I come from the cannabis space. I was growing in my dad's basement, and made a lot of the same mistakes a lot of people did back in the day. And just because I use cannabis more than I personally use CBD, I'm generally healthy. I use the roll-on for my back pain for golf, and that's about it. But nothing makes me happier than giving, nothing used to make me happier than the 100-pound sale or the 100-liter sale, the big cannabis sale. That was it. You sell $250,000 of weed. That was I'm 23, I'm selling legal weed. That was it. Now I give someone a roll-on or a CBN tincture or a dog treat for free, and they tell me how much it helped them. That makes me happier than selling any amount of weed. And the fact I can send them over state lines, I can send them to people's house. If I have a friend or a customer who says, my grandma is not doing well, my dog is not doing well, I can have products at their house 2 days later.
Yeah.
And I feel like I can help more people. You know, even though I'm more of a smoker, people are going to get high. People are going to find good weed. There's a lot of great flower brands and pre-roll brands in Missouri and all over the country. And there's great caregiver product too. Like, people will find good weed and get high and enjoy great flavors, whether I'm doing it or not. But on the CBD side, I feel like there isn't as much accessibility to good brands that do everything well and make like a full line, especially in the dispensaries, because everyone in the dispensary business is focused on cannabis.
Right. Right. And it's a lot easier introducing your parents, maybe reintroducing your parents into, you know, CBD and cannabis by giving them a tincture as opposed to like a stash box. You know, it's easier for that reintroduction. So
that's the only way I was able to get my mom and my grandma into it. Bingo. You know, my dad smoked his whole life, but my mom wouldn't touch it. And she has the roll on in her golf bag, and she eats our CBN gummies every night.
That's right. That's right. Willie, this has been fantastic.
Dude, thank you so much.
Of
Seriously.
course.
This went by
I could literally talk to you guys for like another hour. That's my problem with these podcasts is what, you know, like there's so much to talk about. I actually went on one recently that was like pushing 2 hours, and I had to hit the guys. I was like, are we done? Because I'll just keep talking.
That means that we get to have you back again.
Yeah,
because we get to talk.
That's the best.
We get to talk again later this year and next year about what you're continuing to do. And I will say, I think you're the first hemp company we've had on the podcast. I couldn't be more appreciative of you. We've always been big supporters of the hemp industry and of cannabis in general, and I really think that you guys just do such a good job. So thanks for taking the time and coming and hanging out with us and talking to us for a while.
Willy
I appreciate it.
Everybody. Let's play red light, green light. Only not the one you played as a kid. This one's very much for adults. Here we go. If you haven't tried Curio Wellness cannabis products, that's definitely a red light. But it's also a green light, because Greenlight Dispensary Southeast is the new home of Curio. For the best flower and edibles in Missouri, ask for Curio by name at Greenlight. You've got the green light, go.
For use only by qualifying patients or consumers at least 21 years old. Individual results may vary.